Okay, welcome to our Tuesday night workshop. And I always like to start the workshop just taking a moment to thank you for being here tonight. There's many things you could be doing on a Tuesday night at 5:45, and there are many people who are not showing up on a regular basis to really educate themselves on things that support their health. And so you being here tonight and choosing to be present with us and engage with us will allow you to leave maybe a little bit differently 25-30 minutes from now. Maybe will help hold you accountable to doing what you believe is the most right thing for your health. That is one thing, and one reason why Doc and I do these workshops is because every time we dive into the conversation on health and are reminded as to why we do the things we do. It's easy to make decisions based off of how we feel, what is easiest and what is most convenient. And when it comes to health, it really does require discipline and a commitment. So thank you for being committed to be here with us tonight. So this is a new workshop topic. And what we find in the office is things are pretty normal for us. The techniques and the tools and the tables, chiropractic, it's very much us. We hear about it, we learn about it, we train about it. And it's been a part of my life since I was born. My dad's a chiropractor in Doc's world since she was about 6-7 years old. And we recognize that although it may be normal to us, it is very new to others. And so we wanted to just take a workshop to really sit with the techniques that we use, what we specialize in, how we assess health, and what we look at in terms of goals. So let's start there with our philosophy. Now, when you look at chiropractic, it falls under a model called salutogenesis, which when you break those two words down, means the birth of health. Now let's take a step back quickly, because chiropractic is very different than our traditional healthcare system. Our traditional healthcare system is an allopathic model, which is basically when you break allopathy down, or allopathic down, is the study of disease and the rendering of treatment based on that disease. So our model in chiropractic is based on a foundation of health. What brings health? What takes away health? How can we support somebody moving into a higher state of health? Very different than studying disease. What causes disease? How do we treat disease? And so understand that when you walk through our doors, already we're a different model of care. And when we talk about the birth of health, I think it is appropriate to really look at how the World Health Organization defines health. And I'm sure most of us have heard of this definition. This is from 1986. Health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So when we look at that definition of health, and somebody walks into our office really looking for help and support, we're looking at how can we measure health in this person. And so our philosophy when we render our exam, and the chiropractic exam is really meant to assess, is there presence of subluxation? And when there is subluxation, you see Colleen up there, thank you. When we do see subluxation present, we know that it's impacting the brain, the nervous system, and the spine. And chiropractic is really looking at how does the brain process our world, because it is the most important organ. It was the first organ to form in utero, and from the brain came every cell, organ, gland, tissue in the body. And brain was in control of its function and development from day one till last day of life. The only thing fully encased in bone. And so we want to make sure that the brain is supported in how it processes our world. And we know if there's subluxation present, it is impacted by that. So the way we use lots of tools to measure the health of your brain and your spine, but a big portion of assessment here in our practice is using x-rays. X-rays is a great way to gauge how is your spine aging. We know if you move your spine and take care of your spine, throughout life, it should maintain that structural health between 90 and 125 years before breakdown. That doesn't mean it goes kaput at 90. That means it's when it starts. And so if we see breakdown happen on an x-ray much earlier than that, it gives us an idea of how much stress the brain, the body, and the spine have been under. The other big assessment tool we like to utilize in our practice is we want to assess how is the brain functioning? How is the brain adapting? And that's where we use that neuroscan, where we break down those three components of brain and nervous system function. And we know if we can support your reserve and your ability to adapt, then that means you can handle more physical demands. So those are both done on your initial exam. And we'll go through a few other components of the exam to assess your health. And we do those scans in your initial care. We do those 3 times because we want to see, is there a trend or a response with how your nervous system is doing? X-rays we don't do as frequently, but as we introduce more, I guess, support in your care later on, we do talk about taking X-rays again. Another thing I think that sets us apart from other practices in healthcare, but certainly in other chiropractic offices, is we believe that education is the most important thing in our practice. The subluxation above C1, so up here, in terms of what we believe health to be and our thinking and the choices we make every day for life, is the most impactful in terms of our trajectory we're on. So if we don't address what's going on up here and just address everything below, then we believe that there's a major component of care missing. So that's why we do spinal workshops. And if you remember going through your experience on your first visit, on your second visit, we take a lot of time to really support your understanding of chiropractic. A lot of people don't really understand chiropractic. They believe chiropractic is solely for low back pain or headaches, similarly to our traditional healthcare system. But we, as we just discussed, are looking at health based off of what is keeping you from health. What is your measure of health, not just as a diseased person, right? So education is big in our practice. And so what do we specialize in? Sorry, I found that red line there. Okay, I won't worry about it. So what do we specialize in terms of technique? How do we render care or adjustments in our office? And so again, our purpose is to identify if there are subluxations present within your spine, impacting your health. And so we use an adjustment either done by tools or hands to really help correct that subluxation. And as a result of that, you impact how the brain responds to the world. So your chiropractic technique, there are, I don't even remember. I mean, I'm trying to remember in a seminar, somebody counted all the chiropractic techniques, and there was something like 100 or like 200 or 300 chiropractic techniques. There's a lot of chiropractic techniques out there in terms of how we address the subluxation when we lay hands or use tools or use the tables to adjust you. These are the main ones that we use, and they can range from something that is low force, minimal input into the body, to something that's more manual, more movement, more people experience more change physiologically right away with those in terms of movement. So when you see this guy, can you see that? I'm going to stop sharing so you guys can see here. So when you see this guy, this is called the activator. Okay, here's the activator. So anytime doc is using the doc or I is using this tool, it's called the activator, and it gives one quick impulse into the body to deliver the force. Now, the difference between an activator and something that is a more manual adjustment, let's say you're laying on your back and doc or I do like a bear hug. We introduce force into the front of the body, or we do more of a manual adjustment on your neck. They've done studies and found that the force delivered by an activator And that one impulse is the exact same force delivered in a manual adjustment. It's just with a manual adjustment, there's a lot more movement that's introduced into the body. And when we deliver a very specific impulse into the spine, it just impacts more of a global region. And so Doc or I will use instruments like an activator to help support the adjustment. This is called the arthrostim. Okay, arthro. Let's see, I'll come back here.
What is it called?
It's called the arthrostim.
Oh.
Arthro stands for joint, and stim is stimulating the joint. And what this delivers is a specific input over and over and over at a depth that whoever's using the tool can go a light force, or it can go deeper. Doc has something that's called an impulse, which is very similar, but it's introducing a very specific stimulation into the joint that is consecutive in nature. And it's done at a frequency that helps support body response. So you will see us using those tools that fall into this low force category of delivering an adjustment. And when we use these tools, what's happening is that whether it's a manual adjustment or using the instruments, is we are firing on mechanoreceptors. And mechanoreceptors are the receptors that respond to pressure and touch. A lot of times people will, if you hear a pop or a crack, oftentimes you'll say, oh, I got cracked. It's actually not a bone moving. It's the actual term for it is called cavitation. And if you look at the joint is covered in it's a closed system, and it's a fluid filled joint. And so when you deliver a force into that joint, that force has to go somewhere, and it's little bubbles actually popping out of that fluid. So it's pop, 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 pop. And then over 20, 30 minutes, those air bubbles absorb back into the fluid. So when you get more of a manual adjustment and you hear those cavitations or those pops, that's not the bone moving. That's actually that force being delivered into the joint, and that force has to go somewhere. Okay. We are not moving bones. We are not doing the healing. We could never take credit for what is happening within your body. So Doc and I are just the technician, or really the chiropractor that is assessing for where are these subluxations and how can we support the body to take stress off of where we're finding those for the brain to do what it's meant to do. I could never take credit for the amazing healing capacity that is within each of us. Right? We all started as like 2 cells that became 1, then 2, then 4, then 8, then 16, 32, 64, 108, and so on and so forth, that became a human person. Science has yet to create a human and life, really. And so, as I'm talking about, Monarch's chiropractic technique and philosophy, we will always give credit to your body. You need nothing from us, just no interference and stress. When we take that interference and stress away from the system, then we can see a body that expresses a health and vitality, and we see miracles. That is normal in the practice. And really, normal is health, normal is vitality. We've just been conditioned to believe that disease and chronic problems and aging is, something that happens to a lot of people. And in this office, we believe that you have the ability to age in a very graceful and vitalistic way. So back to chiropractic technique. So you can have low force adjustments. These are just the names of these techniques. Activator, I use something called Corinne specific technique. It's KST. If you ever see my hands on the back of my head, or if you feel my hands on the back of your shoulders, I'm looking for a very specific muscle response to see where I need to go in your body to adjust your spine. Logan basic. Logan is if you ever feel sustained pressure right at your tailbone, you feel, doc, are I moving up along your spine towards top of your head? That is called Logan. That is meant to address deep stress to a nervous system to help for unwinding to happen. We're working with your cerebral spinal fluid, that is a thick, viscous, or syrupy material that covers your brain and flows from the brain down the spinal cord all the way to your tailbone and back up. And this system is cushioning and protecting, but it's also removing any waste that's created by your brain and nervous system. So it's constantly clearing things out and cleaning things up. And there should be movement there. So we are really checking for that movement all along the spine. And then if we work into any of your cranial bones, we're also working with that system. We have sacro-occipital technique. So if you ever see somebody who's laying on a board and laying on blocks, we specifically block their body based off of how they're presenting, and their breath work does all the work to unwind and support that adjustment. Then we have Webster, which is a specific technique for pregnant women. It is designed to address all the tension and tone that we typically find, so that we want to balance out that pelvis to allow a baby to grow like that baby is meant to grow. And then you get into more manual adjustments, which are done by hand. We can use, or done using the drops or different drops that we have on the table. And that could be like a Thompson technique, where we look at leg length, and then doc will oftentimes have you cross your leg one over the other. That's a specific technique called Thompson. Gonstead is using X-ray as an assessment and really using X-ray to see where adjustments should take place. Sometimes that can be seated, sometimes laying down. Motion palpation is something where we're really motioning the spine, looking at how it's not only aligned, but how it's moving. And again, instruments that we use in our office. We are very specific in our adjustments. Oftentimes less is more. Sometimes we can get into our heads and think we need more. And oftentimes we find that less can be more. Give specific input into the nervous system and allow the brain to do its thing and not add any extra confusion. So we like to really be very specific and only adjust what we think is appropriate based off of the technique and the objective measures we have. Okay. Continuing in with technique and specialties, we consider ourselves a whole family care office. The youngest patient that we've worked with is days old. My kiddo actually got her first adjustment on the first day of life, but it was not in practice. It was at my home. My dad adjusted her. I know doc checked her kiddo right away and then said, as soon as she could, said, let's get somebody else to check him. And then the oldest patient we've had in our practice is 90. So, and there have been times where we've done house calls because chiropractic can be very supportive. If there's an injury or if you're just unable to get to the office, we will come to you. We do specialize with pediatric care, pregnancy. Doc and I have, I guess, a real desire to support health from birth. And we see that the health of a child actually happens pre-conception. What's the health of the mom? What's the health of the dad? And so we find that when families are under care and when mom and dad understand the importance of a healthy brain and nervous system moving through development and really starting a healthy trajectory at the start of life, it can really impact that kiddo years down the road. So we work with a lot of pregnant moms, a lot of kids. We have certification with working with and understanding healthy brain development. And then if there's any neurodevelopmental delays, if there's a kiddo that falls on the spectrum like autism, ADD, ADHD, Asperger's, we have specialized education, really understanding what's going on in the brain and what does this kiddo need in terms of the chiropractic lens to support that brain. And we have special education and support with trauma-informed care. So we've done some work with polyvagal tonal work, both for adults and children. So no, when you're coming to our office, we are looking at you through multiple lenses and have multiple tools to really support you and your family and your friends. Corrective care, I would say, is also a big portion of care here. We are taking x-rays and we want to know what is the health of your spine. If you have structural or degenerative changes, oftentimes you need more than just the adjustment, right? Adjustments help start creating a foundation of health and movement in a spine. But then we need to go the extra step to start correcting what is there. So if you have a curve that's not there, that should be, then we use dental rolls, fulcrums, a cerviguard, which is a specific collar that we can put on your spine that will help enforce where that curve should be and helps remodeling. I would say this is something that everybody should be doing at some point in their care. And probably within the first 3 months, depending on how somebody's coming to us, we want to start having this conversation more seriously. We also do injury care. We see a lot of people who've been in motor vehicle accidents and work accidents. But if you are in any type of auto accident, even if you think it's minor, I mean, I've talked to attorneys who used to work for insurance companies who hired them to say, we want to see at minimal impacts that there's no injury. Well, they weren't seeing that. Even a 5-mile-per-hour impact can have injury to a spine. That force has to be absorbed somewhere, and it's absorbed into our body. So if you've been in a motor vehicle accident, you have a friend who's been in a motor vehicle accident, the best thing you can do is have somebody assess the health of your spine. You know, going to the hospital, they're going to be ruling out broken bones, anything that is not okay in terms of internal organs that have been damaged, or, you know, blood vessels that are impacted, or breaks. That is not most people. Most people are dealing with some pretty significant musculoskeletal injuries. And so my hope is that for anybody who's been in an accident, that they just get assessed. We can see people 20, 30 years later that got into car accidents that are experiencing some major stuff health-wise, and that starting point, that injury point, was really that motor vehicle accident. So we want to make sure that gets assessed pretty quickly. We also do some support in terms of the weekend warrior, or we've worked with athletes before. There are practices who really like to focus on, you know, athletes and performance. You know, we're not necessarily looking for getting a professional team in here to support their performance, but we are interested in helping your high school kiddo, if you have a college kiddo, or if you're doing recly on the weekends, we're interested in making sure we're supporting you. And, you know, that's where you see in those other modalities. We do offer some cupping. Cupping is a Eastern medicine approach to help support your soft tissues. So it's those cups that we place on there, you might see it in an acupuncturist. We do have a laser. We do use K-tape. We also recommend nutritional supplementation. We do custom orthotics and pillows. So there are some supports that we have, but we believe that the adjustment is primary. If you have a stressed brain, your spine's not moving in a healthy way, then we can add all these things in, but it's not even coming close to what the adjustment can do. And then I would say the big thing about our practice is we are a wellness practice. We have people, I mean, docs, we can both attest to it. She was just sharing that one person that she's been seeing for 12 years, almost, you know, on a weekly basis. A lot of times we transition people from initial care to continued care, even into wellness. And there's some people I've been seeing for years, every week, because there's research out there that shows if there is a stress to the body and it's there for 7 days, it can become a permanent adaptation within the body. So we believe that, you know, at minimum for me, I want to get checked every 7 days because I'm wanting to make sure my health is, and adaptability is at its highest expression. There's also some other research that shows that if it's been around for up to 3 weeks, it can become a permanent adaptation. And so we do have some people who see us every week, every other week. Some people go every 3 weeks out, but with the world we live in, I mean, I don't know anybody who says, oh yeah, stress has gotten a lot less as I've gotten older, right? There's just a lot more components we're dealing with. And so, you know, for people who are looking at getting into more continued care, you know, maintenance type care, oftentimes we don't recommend people go out further than every other week. But we have a big base in terms of people who choose to get wellness care. And so healthcare goals. I think we can all agree that we are a culture that really bases our health on symptoms. And I want you to understand that symptoms is the tip of the iceberg. I'm sure you guys have seen this before. If we are just focused on what's going on up top, there's a whole picture going on down at the bottom. And so if we're focused on pain or symptoms, what does high cholesterol feel like? What does high blood pressure feel like? What's cancer feel like? What's heart disease feel like? I mean, cancer, it takes 8 to 10 years in some cases for it to become large enough for us to identify under a microscope. High blood pressure is the first sign of heart disease. How long does it take for somebody to get into an obese state? It doesn't happen overnight. And so I find that people who are getting chiropractic care, especially at the level that we provide in terms of, you know, what we are collecting as far as your health care, we have some really great data, and we can start to see early on if you're shifting or if you're moving on a different trajectory. We can say, I have seen you for years, Joe, and where you've been shifting in the last 3 to 6 months, there's something going on. And it's not for me to find that out, it's for you to really address. And has something changed? But we can start really, you know, having a bigger impact in terms of your health, not just basing it on how you feel. Because a lot of times when we're looking at our health shifting and changing, we don't necessarily know we're on this path until, you know, much later on. So we want to look at how can we really assess function and health in a big way on a day-to-day basis. Because I love this spectrum here, health and disease. It's just almost too simple, but every choice you make will either put you towards disease or put you towards health. You can't be in both states at once. So are you growing and expressing higher levels of health, or are you moving away from that, you know, and progressing into, you know, deeper states of age and disease and death? You can't be in both states. And so, and this is where I'll wrap up. I mean, we do have, you know, oh, it says short-term goals, but we have our really short and long-term goals is to first assess where are you and what can we do to help support repatterning, reorganizing of neuromuscular patterns. How can we improve your range of motion, your movement, your mobility, your flexibility? How can we make sure we're having measurements to gauge, are we seeing, you know, strength go away? Because we know that starting at age 30, you are losing 1 to 2% of your body mass every year, or muscle mass. Frailty is a real thing. We have a lot of people as they age who are moving towards disease much more quickly, and that's a lot of people. So we know that if you are moving and if you are mobile and you are carrying healthy muscle mass, and you've got a healthy brain to adapt to stress, then that person is going to be very different on their feet at 70 than somebody who is not doing those things. And I can tell you, I've had multiple people who've been getting care and chiropractic care for years who go into surgery, and their, you know, PT, their MD, they will say, wow, you are really coming out of this at a different state. You are like head and shoulders above what we consider average. And that is because those people have been taking care of their structure and their brains. They're more adaptive and more responsive for when those necessary procedures at times need to take place. You know, pain management is in there, but it's not the first thing, because pain management, symptom management is the symptom. We really want to build a foundation of health. And if it took 20, 30 years to get into that state, it's going to take time to create a different foundation of health. And really our long-term goal, yes, we have those short-term goals and we still measure those. We still keep track of those, but under a bigger realm of care, right? We have objectives, but what's the care look like within those timeframes of, you know, if somebody gets and has exacerbation of flare-ups, maybe it becomes more of a treatment type scenario, but it's still under the umbrella of care. So long-term, we want you to experience health and vitality at every age. You have a 70-year-old who is healthier than they were at 40. You have somebody who is, I mean, you can have a very vibrant, healthy 70-year-old who is running marathons. I think I saw like a 90-year-old doing gymnastic moves on some social media site last week. Is she any different? Does she have like super genes and genetics? She's any different than the rest of us? Or has she chosen to take care of her health in a very different way than the rest of us? And that's where I'll end here. Being healthy is a lot of work, but being sick is a full-time job. And so, you know, my hope when you hear, you know, what we're going over today is that you are choosing to be more intentional and more disciplined and more committed to the choices you're making. We will come right alongside you. We will support you in that. But it comes back to each one of us. We all have to take responsibility for the choices we make on a daily basis and the health of our brains and our spines. And I mean, our greatest wealth is our health, right? I think a lot of people don't know how important the health is until it's taken away from us. So thank you for being here tonight. My hope is that as I talked through some of the specialties and techniques that we utilize, it maybe gives you better understanding, more confidence in the care that you're receiving in our office. You're maybe more confidence in who Dr. Kristen and I are and what we stand behind. And I also hope that if I was, you know, saying some things or sharing some things in terms of our specialty, that maybe there's somebody who popped up in your head who doesn't know what you know. Maybe there's somebody who could be helped. The worst thing that we could hear is, I wish somebody would have told me a long time ago. And so if there's somebody in your world who you know that could benefit from care that we offer in our office, or even showing up at a workshop, I ask that you invite them to join in. Either come to the office or, you know, send them a recording or show up on Zoom live. We can't do this alone. Doc and I really want to change the health of our community, and it's our community, and we can't do it by ourselves. And that's where we ask that it's your community too. Who can you help support? A friend, a neighbor, a colleague, a family member, and their you know, trajectory of health and their health care. So Dr. Miaken of Monarch Family Chiropractic, appreciate you being with me tonight. And if you have questions, I would love to hear them. Oops, let me stop that.